Hey everyone, how are you guys doing? In this video, I'm going to be talking about my Step 2 CK study schedule. I scored similarly to my Step 2 CK as I did on my Step 1, so if you haven't seen that video, please check it out here. Step 2 CK focuses on four major things. 1, what is the diagnosis? 2, what is the best next step in management? Best next step. 3, pharmacology / pathophysiology of a disease or drug. And 4, what test would you order in a certain clinical scenario? Keep those 4 criterion in your mind as you study, because that's essentially the test and the type of questions that they ask. So make sure you frame your mind and think in those 4 questions as you study. Alright, so the first thing you guys need to do is determine how much time you have to dedicate to this exam. If you're an IMG, usually you have between 3 and 6 months, or if you're a US medical student like myself, you usually have a few weeks. I only had 5 weeks. As far as my particular timeline, I spent 5 weeks total, as I mentioned, between 8 to 9 hours per day with 1 half day off a week for rest. I highly recommend that you guys take at least 1 half day off a week for rest, because it allows you to recuperate, process the information better, and tackle the next week of studying. As far as my study materials for this exam, I only used 3 resources. That's right, just 3 resources. I firmly believe keeping things simple is the best way to go, because it allows you to study effectively and efficiently. The 3 resources I used were Step Up to Medicine, the book right behind me, UWorld, and online med ed videos. Out of all the 3 resources, I think that UWorld was the most important one. I felt UWorld prepared me really well for the real exam, so make sure to do UWorld. Also, for UWorld, do 5 questions at a time. A lot of people do 40 question blocks at a time, and I don't recommend that at all. People that do 40 question blocks all at once, they tend to just skip through it and they don't really focus and process the information that well. I highly recommend that you guys do 5 questions at a time, then review it, then do 5 questions, then review it, so on and so forth. I actually didn't use Kaplan or First Aid for Step 2 CK because I felt those resources weren't very helpful and didn't really cover the material well. UWorld actually did a great job at covering the pertinent subjects and going over the appropriate amount of detail. Kaplan in particular usually covers a lot of excess detail that's not necessary for the exam, so I didn't really like Kaplan. For me, for UWorld, I did between 80 to 100 questions per day, and that amount was perfect for me. For my exact study schedule, I started immediately with internal medicine. Internal medicine is the basis for the other clinical subjects, so mastering it will give you a good foundation for the rest of the clinical subjects, particularly pediatrics. So start with internal medicine first. Internal medicine is a big subject, so I like to break it down by organ systems, and that's how I approached my study schedule. I felt it helped me tackle it effectively, and it really solidified the knowledge in my head and helped me on test day. So I recommend you guys break it down by organ system too. I wanted to get the hardest and most important internal medicine subjects out of the way first. So I first did 3 days of cardiology, 3 days of GI, 3 days of pulmonology, and 3 days of renal. Then I did 2 days of hematology oncology, 2 days of infectious disease, 2 days of endocrine, 2 days of rheumatology / orthopedics, and then 2 days on dermatology / ENT / ophthalmology. What I did on the first day of every new organ system for internal medicine was spend the day reading the corresponding section on Step Up to Medicine, the book behind me, and then I spent the rest of the day doing online med ed videos. And then the remaining days, I would do between 80 to 100 questions on UWorld for the corresponding section. So for example, for cardiology, I spent the first half of the day reading the cardiology section in Step Up to Medicine. Then I spent at night watching all the online med ed videos. And then the next 2 days, I would just do UWorld dedicated between 80 to 100 questions a day until I finished the subjects. I did the same thing with pulmonology, and the same thing with hematology oncology, so on. So for hematology oncology, I only spent 2 days on that. So the first day, I would read the hematology oncology section and step up to medicine. At night, watch all the videos on online Medi, and then the next day, just do dedicated UWorld 80 to 100 questions per day until I finished the subject. For the non-internal medicine clinical subjects, I did 2 days of psychiatry, 2 days of neurology, 2 days of surgery, 2 days of OBGYN, 2 days of statistics, and 3 days of pediatrics. I recommend 3 days of pediatrics because there's around 400 questions on UWorld, so you probably need the extra day to tackle those questions. For those non-internal medicine subjects that I just mentioned, I didn't read anything for them. I just did dedicated UWorld at 80 to 100 questions per day. That was plenty for my exam, and I felt completely prepared on actual exam day just doing UWorld alone. In fact, I didn't even watch all of the online med ed videos for those subjects. I only watched them in the areas I was weaker in or in areas that I felt like I wanted to understand better. But you can get away without doing any of the online med ed videos and just doing UWorld for the non-internal medicine subjects. You will be fine. Trust me. I promise that you will be fine. So in addition to that schedule, I also did one NBME a week. I spent the first half of the day doing the NBME and the second half of the day going over it with a friend. And that was extremely helpful. I understand a lot of you guys might not have a friend or someone to do it with you, especially if you're an IMG. So I'm going to put a link in the description to some Facebook groups where you can find other people going over NBMEs and you can work on them as a team. Also, I have some websites that might be helpful for the NBMEs, and I'm also going to put a link in the description. So make sure to check those out. When I was studying, I also looked at USMLE World and SDN, and I felt like those websites really helped me, so make sure to check them out as well. The last thing I recommend is taking the day before your actual Step 2 CK completely off. Just relax, think about something else, don't worry about anything, and clear your mind, because the actual Step 2 CK is a 9-hour exam with 8 blocks with only 1 hour of rest. So you want to have your mind clear the day before so that when you do take the exam, you're relaxed, calm, and ready to tackle the whole thing. Alright guys, that's my video. I hope you guys liked it. If you did, please subscribe below, give me a thumbs up, and comment. I actually respond to every single comment on my videos because I love to teach and I really want to give back to the community that helped me so much. A lot of IMGs and other medical students helped me during my rotations and helped me during step studying, so I made this channel so I can kind of give back that knowledge. I want to see you guys do really well on these exams and get the residency of your dreams. So I hope this video was useful and, will get you a higher score in the end. Okay? Take care. I wish you the best of luck, and I'm sure you will knock it out of the park. Good luck on Step 2 CK.
Hey everyone, I hope you liked that video. Please remember to smash that subscribe button below if you guys want more content or more videos like this. Thank you. German out.